Hello, everyone. Welcome to the World Government Summit webinar series themed under COVID-19 and government. Today, we will be hosting our second session of the series titled, Will COVID-19 Change Governments Forever? We are very lucky to welcome esteemed panelist, James Robinson, economist, professor, and author of Why Nations Fail, and also Mina Al-Arabi, editor-in-chief from The National.
For that introduction. Welcome everybody to this World Government Summit webinar. COVID-19 as a term meant nothing to just about every one of us up until 5 months ago. The world as we know it has changed in great ways. It's changed how we live, how we work, how we learn, how we interact, as you can see from this webinar. And some people, many people, feel a loss of agency, a sense that they do not know what's best and need to turn to their governments to see if they can find the solutions to these many questions that we have. When will it end? What happens if the economy doesn't pick up again, with actual shutdowns being forced in different parts of the world? The IMF has warned that this is similar to the Great Depression, and that was followed by the breakdown of many government systems that we know and war. And so people are rightly scared and looking for the one place that hopefully has the answers, which is government, and how will government lead? That's what Professor James Robinson is here to discuss with us today. As we look towards governance and governance systems, the biggest marker in my mind for legitimacy at the moment is coming through competence. As every day we follow the numbers at the newspaper I'm at, The National, we every day look at the numbers in the UAE, in the region, in the United States, in the world, and see how we're doing in the fight to test more, to make sure more people are recovering, and unfortunately following the scary numbers of deaths and increased cases. And so as we follow those numbers and we look at how different countries have reacted, in large part, their response is being led by governments and the decisions that governments are making. And so James will shortly do his presentation explaining to us how governments have reacted, but also the future of governance after COVID-19. Throughout, we would appreciate it if you could submit your questions in the Q&A section. And after James finishes his presentation, I will be posing some of those questions to him. Please welcome James, although we don't have round of applause, but do welcome him with me. And, applaud in your own ways and do submit those questions. James, the floor is yours.
I'm delighted to be involved with this initiative, and thanks for that very generous introduction. So I've been thinking a lot about the current situation, and I think there's many things I could talk about and many things I'd be happy to talk about in follow-up or whatever, but I just wanted to focus on the main thing that just keeps me up at night at the moment, and it's very closely related to what Mina Al-Arabi emphasized, which is, thought of from the point of view of political philosophy. This is what I call the very Hobbesian moment. When Thomas Hobbes was writing in the 17th century, the great political philosopher, theorizing about the state and government, he was thinking about warfare, order, sort of visceral moments when people are desperate for security and help and order. So the pandemic is an example of a visceral Hobbesian moment. We want help, we want security, we want protection, we want aid. But at the same time, and especially in the United States or the Anglo-Saxon world, this Hobbesian moment is coming at an instant of historically low trust in the government. If you look at the data that the Pew Research Center have put together over many years, you see in the United States, the picture in Western Europe is similar, but the decline is much, much lower. You see this incredibly low level of trust. About 20% of people trust the government in Washington always or most of the time. So this to me creates, what I see almost like a contradiction. There's a disequilibrium. We need the government to do things. We need it to help, but we don't trust it to do things. So how on earth does that happen? And when I think about this and how we got into this predicament, I'm always reminded of Ronald Reagan's famous joke or aphorism, I don't know how you want to think about it, when he said, the 9 most terrifying words in the English language are, I'm the government and I'm here to help. The 9 most terrifying words, but now we want the government to be here and we want it to help. But for 40 years, since President Reagan came in, politicians throughout the United States, and in Britain it's pretty similar, have been bashing the government and denigrating the government. And that's created an enormous problem for dealing with this situation. What's the consequence of that in the United States at the moment? Civil disobedience. You know, that's happening in Chicago. Just today in downtown Chicago, people are organizing protests against the mayor and the governor, against social distancing measures, against closing shops and businesses, against, here's people demonstrating in Michigan. Look at this scene, people with machine guns outside Michigan's Capitol building, okay? This is the consequence of this disequilibrium I'm talking about. And I think in many ways, the nature of the shock or the response to the pandemic is exacerbating the underlying problems that have created this distrust in the state. Think about inequality. You know, for somebody like me, my wife is also a professor, we can move home, we can teach from home. We're not risking unemployment, we can self-isolate. This is about a third of the labor force that can do this. What about low-skilled people? What about people with low levels of education? They can't work at home. They have to deal with their kids off school. They may be in professions that are reserved, so they have to go out and they have to bear the risk of getting the disease. In the United States, millions of them will not have healthcare. So it's a sort of inequality and also social dislocation disaster. You know, one of the most kind of prominent hypotheses about where we are today and this falling trust in the state and in other institutions as well is due to Robert Putnam, my former colleague Robert Putnam, in his book Bowling Alone, who analyzed how since the 1960s, over the last 60 years, there's been an enormous decline of civic engagement in the United States, lower levels of associational life, lower levels of collective solidarity, for example, falling membership of trade unions. Okay? This type of isolation, fragmentation of society is only exacerbated by the current situation, unless we can be creative. You know, here's a City University of New York School of Public Health poll. They're doing a weekly poll of people in New York City. 40% of people they surveyed felt anxious, 32% felt depressed, 43% felt no social connection. So it's isolating, it's fragmenting society, and it's exacerbating these broader sociological trends, it seems to me. So you know, what's the consequence of that? I think you know, we're at risk at very divergent outcomes. And I'm an academic, you know, so I made up a nerdy diagram to talk about this. Let's see if I can just get across the idea. You know, on the one hand, and this is what's on the vertical axis, is the increase in the state responsibilities. The state has to take on new tasks, it has to take on new responsibilities, it has to monitor, it has to do, you know, trace contacts, it has to control people, it has to shut down businesses, it has to close parks, it has to enforce social distancing, it needs to do all sorts of things. So on the one hand, we need the state to do a lot now in order to control the disease. On the other hand, and this is the red increasing line, there's only so much society will put up with. So trust in the state, which is on the horizontal axis, in some sense, your level of trust determines the extent to which you're willing to allow the state to take on these new responsibilities. So if you're in a happy situation to the right of X on the horizontal axis, you know, that's a position where people are willing to let the state take on the tasks that it needs to in order to fight the virus. Okay, people trust the state enough, they're willing to cooperate, they feel the state is going to work in their interest and it's not going to abuse these new powers. To the left of X, which I very much fear that's where we are in much of the United States, people don't trust the state enough to allow it to take on all these new tasks. That's why there's all this civil disobedience spreading throughout the United States. And then you have a disaster, and this is the divergence. What do I mean by a divergence? Well, think about what's happened in a place like South Korea or Germany, where the government got organized, there's been testing, contact tracing, the disease, you know, the pandemic has been contained. the government takes on the tasks, it implements, it does a good job with the disease. People feel more confidence, trust increases. That's a good scenario. But the other scenario to the left of X is the state can't do these things, so it does a bad job. People, now in Illinois, we're talking about, the governor's talking about opening things up because of all this civil disobedience, but there's 3,000 new cases every day. There's no signs that the pandemic is dissipating in Illinois, but anyway, we're going to open up. So people are going to get ill, they're going to die, and it's a disaster, and it's a situation of falling trust. People will feel even less trust in the state. This is a scenario, the way I tell this scenario, it's, the change in state responsibility society is, willing, allows the state to take on. You might say, well, that doesn't apply to authoritarian countries. No, authoritarians don't consult the people. They just take on state authorities. The Chinese government didn't consult the people when it decided to lock down Wuhan. It just did it, and end of story. But I don't think it's as simple as that. Every government relies on legitimacy. Drones are not a substitute for legitimacy and the cooperation and trust of its people. And in many parts of the world, especially China, for example, which has, since the late 1970s, the government has legitimated itself by delivering, by competence, as Mina said to start with, by promoting economic growth, by raising people's living standards. That's going to be a much harder thing to do in a much less globalized post-COVID-19 world, it seems to me. So everybody is going to rely on the cooperation, on trust of people in society. So you could think of, imagine you're to the left of X, where people don't really trust the state enough to kind of allow it to do all these things, but it does it anyway. That creates what I'm calling a legitimacy gap here. So that's also a problem for governance, and it's also a source of divergence in all types of regimes, whether or not they're, independent of their level of accountability. Okay, so maybe you're saying, okay, come on, no, there must be grounds for optimism here, and I'll end up by saying something a little bit optimistic. But there's certainly many interesting historical analyses here. Couldn't it be that this shock sort of brings everybody together? When the North Sea flooded in the Netherlands, everybody drowned. Elites drowned, poor people drowned. So everyone had to work together to build polders, to build, public infrastructure, so they all could flourish. It brought everybody together. That's not happening in the United States at the moment. This is a remarkable picture which was published in the New York Times about the proportion of people in different states that feel extremely concerned about the coronavirus. Blue are Democrats, red are Republicans. You see, there's an enormous political divide about the importance of the coronavirus outbreak. This is a medical issue. This is not a political issue. This is not about the tax rate or whether you should have whatever level of immigration or build a wall, next to Mexico. This is a scientific issue. How can there be such partisan views about this? That's where we are now. And you see, this gap has got larger rather than smaller. So at least in this country, I don't see this consensus emerging. Okay, I don't see that at the moment. What about bringing people together? Surely, you can't, this, but it's going to bring people together. Think of my Netherlands example. Think about the polders. Isn't that where we are now? I don't think so. There's interesting examples of that in the history of the United States. It's going to be difficult for me to explain this diagram, I know, but this is from a very famous study of the spread of public services, in fact, sewers in US cities. And what's interesting about the way this worked is that Black people got services when they lived, with white people, essentially. But when they didn't, on the left, that's the extension of the Memphis sewer system. At the top, there's the gray shaded bit, mostly Black people with no white people living there. When Black people lived on their own in ghettos and neighborhoods, they didn't get public services, but when they were all mixed up with white people, they got services. So bringing people together, merging people, provides things even for non-elites or people without political clout or influence. But again, I just see at the moment all this isolation. In some sense, rich people, elites are able to isolate themselves very effectively from this problem. And I think they will carry on to doing so. So one more grounds for optimism. Here's something that my colleagues were talking about recently. In 1972, this is on this very tall gentleman on the right is General Somoza, who was the dictator of Nicaragua before the Sandinista revolution. And in 1972, there was a massive earthquake, which dramatically revealed to Nicaraguans the incompetence and ineptness and corruption of the government. And it solidified a very broad coalition in opposition to the dictatorship, which ultimately culminated in the Sandinista revolution and the end of the Somoza very long-lived Somoza dictatorship. So maybe we're not creating social solidarity by this shock, but it is making dramatically clear the incompetence and lack of capacity of the US government and the terrible inequity of the healthcare system and unpreparedness of the healthcare system and the amateurish way in which the federal government has gone about this. And surely that's going to bring people together and say, like maybe it did in the 1930s in the New Deal or in the 1890s in the United States with the populist movement, enough is enough. We have to reverse this. We need a new project to rebuild institutions in this country. And my answer there is maybe we're seeing that. Maybe. Okay, so let me finish by saying what should we do? What should we do about this? This is a very worrying moment, and it's a critical juncture, as Mina mentioned. It's a way. And that's the point of my diagram, is to show societies could go in very different directions here. The US could implode. Other countries could come out of this with more trust in the government, better institutions, more confidence in the state. I see that happening in South Korea, in Taiwan. I see that happening in Germany. Britain, my own country, England is, teetering on the brink one way or the other. But, there's obviously things that have to be done. They have to be done and think of them as things that need to be done to kind of narrow this gap between what the state has to do and what society will let it do. And I think some of these underlying problems I talked about need to be addressed. And maybe technology here is it's very exciting, all of the use of this technology. To me, this is one of the most interesting things. I think it's undoubtedly true we're going to go into a period of lower globalization, lower trade, more autarky, isolationism, people moving less around the world. And that's a bad thing economically, and it's a bad thing many ways. But we can all connect in ways that we'd never thought of before. We've all been sort of like academics like me, we've been closed down. We can't travel, we can't give presentations, we can't. So what? Everything is online. Suddenly seminars are popping up in Hong Kong and in Bogota and in London and in Berlin and it's not just in US, it's global. Suddenly it's created this global community, which was perfectly feasible to construct before. But now we're sort of knocked out of our comfort zone and we've gone and done it because we can't operate the way we used to do. And that's pretty exciting, actually. It's, that's very exciting. So and we need to find creative new ways of using this to reduce isolation and try to bridge social networks and create more solidarity and different sorts of communities. And I'm not sure this ever substitutes for like real life personal interaction, but who knows? We'll learn and we'll adapt. So I think we need to do that. We need to think creatively about these underlying problems. Yes, of course, we need social insurance. In the United States, there isn't even a proper federally mandated policy about sick leave, for example. It's all left to the states. It's a kind of completely incoherent, inequitous. That needs to be addressed. People are ill, people are off work, people can't earn income. And, this healthcare, this is a tough nut in this country, but we have to think about ways of helping this. Maybe just cancelling medical debt, or the government is going to have to come in and cancel medical debt in this country. After mortgage debt, medical debt is the biggest source of personal loans, the biggest source of personal debt in the United States. It's an absolute scandal. So, but and let me end with so I'm saying something optimistic here, I think, in the sense of you know, we're all getting global, and in a way that we hadn't thought about before. And maybe there's all sorts of potential there in very interesting ways. And, you know, when we won't be flying about everywhere. So there'll be less global warming as well. And, you know, but the bigger point here, maybe the deeper point is, you know, we need to bring these things into equilibrium. You know, we need to bring what the state needs to do in equilibrium with what people will allow it to do, or what people are confident in letting it do, you know, letting it do things that they can control and they're willing to cooperate with. And that's exactly the message of Professor Acemoglu and I's most recent book, The Narrow Corridor, which is state and society have to move together, you know, and this is exactly a situation where state and society have to move together. You know, in the US, suddenly you come in and you start closing things down, and people just don't like that, and they're rebelling against it. So if we're going to stop this terrible outcome in the United States, we need to think about how state and society can move together. How can people kind of take ownership and become more stakeholders in these changes? How can we create more accountability? You know, if I was advising the governor of Illinois, for example, that's what I'd be saying. You know, okay, you're talking to all these great medical people from University of Chicago Health Center, but what about, think about social science. You need to bring these people on board now. You can't be draconian. That's not how things work here. So we need to give people a way to fight, to give more ownership in these measures and control over them. And, you know, and we need to improve accountability. You know, again, this is a very US centric thing, but in this country, there's many, many things you could easily do to give people more trust in institutions and accountability. You know, let me just kind of finish with one slide, which is from my own city of Chicago. What's this dark green thing is the Illinois 4th Congressional District. You can see it's ridiculously gerrymandered. It's strategically designed to influence election outcomes. And in fact, it's designed to make sure that Hispanic voters only elect one congressperson. Hispanic voters are all trapped into the 4th Congressional District because of the way it's drawn, to disenfranchise them, in effect, to make sure they influence politics as little as possible. And this country is full of measures like that. That issue of gerrymandering is actually going to come before the Supreme Court very shortly. And this is a moment, you know, this is a moment for people to really stand up and say, you know, we have to put this into reverse. You know, this is un-American. You know, this is un-American. My wife is from Colombia, and she always says, you know, in the United States, if you say something's un-American, you know what that means. In Colombia, if somebody said that's un-Colombian, that would be sort of mysterious. Like, that makes no sense whatsoever. But it's one of the things about this country that's made it move. It's made it dynamic, is this notion of it's un-American, that's un-American. And we need to reclaim that, because I think we've lost it in many ways.
Thank you very much. Lots of food for thought there, and we have many, many questions coming our way. I want to pick up on two themes you raised. And one is that the organization of government. And if we talk about the United States specifically, because so many different countries have reacted in different ways, how do you see government and the way it's organized in the US actually changing because of what's happened, or not? Will it stay the same? And that social contract between citizens and the state in the US changing?
I mean, I think one thing we're seeing is the return of federalism. You know, I must say, you know, I mean, James Madison, who was the designer of the US Constitution, you know, he understood very well that there could be terrible presidents. And in fact, you know, you designed a constitution not for good presidents. In fact, you know, explicitly says you wouldn't really need a constitution if presidents were always good. You design it for bad presidents. And part of that is, you know, federalism. And, you know, that President Trump can deinstitutionalize the federal state, but he can't deinstitutionalize the state in Illinois or California. And, you know, I think what we're seeing is actually a rebalancing of powers, you know, from the central government to federal government. And that's a good thing. This is a very diverse country. You know, California is very different from the South, from New England, from, you know, the Midwest. And so I don't think that's a bad thing, actually. I think that will bring the state closer to the people. It'll improve accountability. And it's a very crucial part of the checks and balances. You know, people emphasize a lot the judiciary or the Supreme Court, or, as checks and balances. But federalism is a fundamental part of that. So I see a big kind of, re-equilibration of this balance between the federal state and the local state governments. And I think that's actually a good thing.
Now, can I ask about the relation between, and this has come up in a couple of questions that have come our way, which is the international institutions. So whether it's the World Health Organization or the UN, how do they fare out of this? Do people have more trust in international institutions or less so?
Yeah, that's a very good issue. I mean, I think this clearly shows how critical global governance is. This is not an issue that one country can deal with on its own. I mean, that's true of many other issues, monetary issues, trade issues, climate. I think it's going to cause a refocus of attention on the importance of global governance. And that's something I think that's gone in reverse, especially under the current US administration. So that's a good thing. I don't know whether it will lead to more trust, but I do think it will lead to an understanding that we cannot do without global governance and institutions of global governance, and we have to figure out how to rebuild them and build new ones and inculcate trust in them. Yes, I know, absolutely.
And another important actor in all of this is the private sector. We've seen governments go to the private sector and so forth. And so should there be a framework for how private actors cooperate?
Well, I think the attempt by the Trump administration to use the private sector has been a fairly dismal failure, actually. My reading of the evidence so far here is that it shows that there isn't really a substitute for public sector involvement. President Trump tried to negotiate with General Motors and other companies to produce ventilators and other medical equipment. And he got so exasperated with them trying to make money out of it that he just used this legislation, which dated from the Korean War, to force people to do it. So obviously a flourishing private sector is crucial for economic dynamism and economic growth, but there's no substitute for government action in a situation like this. The government can act fast, and sometimes that's just what's necessary.
We have a question from the UK, and the participant asks, how do you foresee the balance between globalization and nationalism in the post-COVID-19 world? There's also concern that the EU model of solidarity failed. We saw what happened with Italy, with other countries that felt that the EU did not act swiftly enough.
Yeah, I mean, I'm a big fan of the European Union. I think the European Union has been enormously successful in many ways, but I also think it's been very bad at learning from its mistakes or admitting its mistakes. That seems to be a common problem in politics. And the whole way it treated the Greece collapse, and not learning that some things just don't work, and this disequilibrium between monetary union and and the lack of fiscal union, and so I think the European Union is a great thing, but it's a great thing, but it needs to fundamentally rethink itself. It just seems to have this strategy of kind of putting its head down and trying to kind of tough it out, and that hasn't worked. It hasn't, and it's worked less and less well in the last 10, 15 years. So I'm not sure what this will do for nationalism, but I do think maybe it will encourage the European Union, if this is regarded as yet another failure, the way that they've reacted to the Italian problems. Maybe it's a moment where they can step back and really kind of think laterally. That happened in the 1930s. Society, think about Sweden or Scandinavia, even the United States a little bit, fundamentally rethought how things worked. Britain, after the Second World War, fundamentally rethought how things work. So that's hard to do. It's hard to achieve, but it could happen.
And can I ask, how can governments plan when so much remains unknown? I was speaking to somebody recently who said, usually you have 2 or 3 variables changing, but you have some constants. At the moment, we see everything's up in the air. There are all these variables. So how can governments actually plan for the next stage?
Yeah, I think there's a lot of experimentation required. We don't, there's a lot of scientific, there's a lot of kind of uncertainty about the scientific issues, about the epidemiology, about how society will react, and I think we just about the the vaccines, and I think it's just learning. I think what's going to happen here is we'll start relaxing controls, that we'll see what happens, we'll adjust, but there should be a lot of learning from other strategies. We already know a lot from other experiences, in Korea, in Taiwan, in what's going on in Hong Kong, where they're opening, but in a very specific way, is extremely interesting. We should be learning from that. We should find ways of aggregating that knowledge and learning, and we just, there's going to be improvisation, but planning, yes, but planning means putting in place some basic medical infrastructure to take, to anticipate that the disease is going to go on, and it may resurge and it may mutate, but also putting in mechanisms for learning and implementing these best practices that do seem to be coming up. I think we're learning a lot about that.
I wanted to ask you about inclusivity. You referenced inclusivity in your presentation, but also in your previous work, you've often spoken about countries that are strong and succeed, often have inclusive frameworks or inclusive systems.
Yeah.
The fear now is actually, even though we say we're all in this together, increasingly we're seeing a disparity between the haves and the have-nots. For example, here in the UAE, everybody is eligible for treatment. Anybody who gets COVID-19 doesn't have to worry about treatment. That's taken care of by the government. And also anybody who needs to get tested can get tested and so forth. Not many countries have been able to take similar measures or have taken similar measures. And so the fear is that those who can't afford it won't be taken care of. And then we're going to go to another pattern of a lack of inclusivity. And that is if suddenly we need to have immunity passports. So you need to show that you have immunity, that you can passport, and it becomes another layer of differentiation between those who can get tested, who can get treated, and those who can say that they have immunity, if that's the way we're going to go in the post-COVID-19 world. How do you deal with not making the gaps between different people in different countries even worse?
Yeah, I think that I mean, that's a great question. I'm not sure I know what the answer is. I think the thrust of my discussion is, if anything, what I see in the United States is that this is more likely to exacerbate inequalities, because it's the wealthy people who are able to best cope with this, who have the best medical care. There was an amazing story about New York City of, Warren Buffett using his private planes, to fly in medical supplies, but who has access to those kind of facilities, so it's exacerbating underlying inequality. But I do think that, I do think there's many things in this country, at least, again, talking about the United States, which are sort of very dissonant with the reigning ideology of the country, with this with this emphasis on self-help and upward social mobility and equal opportunity. There's glaring inequities of opportunity. Leave aside, wealth differences or whatever, but there's just glaring inequities of opportunity. So I think there is scope for political agendas which can make that clear to people, how inequitous people's opportunities are. And there's a lot of very good work by economists being done on this at the moment, work by Raj Chetty, for example, making it just absolutely glaringly obvious that this is not right. And, I think you see societies reinvent themselves. My view of the world is that, countries are very deeply rooted in their histories and, the institutions of the United Arab Emirates. That's a very different type of world from, what we have here, even in my own country, Britain, or in the United States. So what's possible in United Arab Emirates or in Sweden is not possible in the United States. But I do think, the big picture, which we talk a lot about in our book, Why Nations Fail, is that if you make relevant comparisons to, say, Latin American countries, which face many of the same sorts of historical problems that the US has faced, the US has done a very good job at fomenting inclusion. And, and I think what you're saying is that and it's met challenges before in the past. I mentioned the 1930s, in the 1890s, and I think what you're showing is that there's going to be a lot of new challenges. There's going to be a lot of new sources of inequity here. There's going to be a lot of new challenges to inclusion. And we have to be aware of that. And we have to think about how we deal with that, and we come up with strategies for coping with that. And that's I agree with that. Yes.
So we've got many questions. One of the questions is, what do you think will be the top priorities for governments post-COVID-19? So once the actual immediate health concerns are dealt with, what becomes the priority?
I think this the problem that we have now was very predictable. I think if you talk to epidemiologists, this was only a matter of time before this happened. We'd had SARS, we'd had, there'd been the Ebola, there were, and it just, the viruses hadn't just got it right yet. They hadn't just got the right mix of, but evolution does its thing, and so it happened once. It could happen again, on the same scale. I think, we have to come up with some plan and infrastructure for anticipating, and dealing with it much faster. If the US government hadn't dithered and bumbled for weeks, the problem wouldn't be on anything like this scale. The government was in denial, so we have to create some mechanism to make sure that sort of inept reaction does not happen again. That seems to be the number one priority, because this is a problem that's not going to go away, it seems to me.
I mean, I guess in your last statement, you answered another question we had, which is, what's the role of government if COVID-19 doesn't end as soon as expected? If it isn't just a matter of a few more weeks and this drags on longer and longer, I guess it's to deal with that ineptitude and to make sure that there are better policies. But is that based on experimentation?
Yeah, I think we, that there was no real plan for how to deal with this, in terms of social distancing and, what's effective, what's not effective. Everything is being made up on the fly. So there's plenty of scope for figuring out what works better. And as I was mentioning before, there's so much variation in the world in the strategies that are being used, we have to figure out how to learn from that and how to implement, what we learn works.
So if you were advising now a policymaker at this moment, what would your advice be to them about the greatest challenge they face, but also what's the greatest opportunity they could seize?
Yeah, I think the challenges are very different depending on where you are in the world. The challenge in China is very different from the challenge in the United States. To me, the biggest challenge in the United States at the moment is giving people ownership in these measures that have been implemented. People have to have more trust in the government and believe and kind of understand that this is necessary for their health, and have the trade-offs and options explained to them better than has been done so far. To me, that's the biggest priority. As I said, the governor of Illinois has a lot of very, very good medical people advising him, but he doesn't have social scientists advising him, and he should do. I'm not volunteering. I'm just saying he's doing a good job, I think, all things considered. But he's done less well on that, and he's stumbling at the moment on that issue. So what's the biggest opportunity? I talked about kind of intellectual opportunity. Maybe that's a sort of second order thing for most people at the moment. But I do think a bigger opportunity, which maybe, this is for politicians, for Republicans or Democrats or whoever it is to sort of grasp, what this tells us about the failures in this society, the broader failures, not, outside of the scope maybe of coronavirus. This is a way of kind of showing people, many of the problems that need fixing in this society. I mean, look at the incidence of this disease on African Americans, for example. African Americans in Chicago are bearing the brunt of, infections, of fatalities, and why is that? That's because of the enormous discrimination and inequity in this society. And it's just unacceptable in a country built on the type of ideology that the United States was built on. And people have to get that across. And maybe this is an opportunity to get that across and build a better place, a better society.
I mean, a lot of that relies on the economy. And of course, there's huge concerns about how deep the slowdown, possibly recession that we're going to go into, and how do we come out of it. And one of the questions that's come our way is that, how do governments accelerate and increase investments and get investors to trust in the ecosystem and to try to, keep the economic wheel going?
Well, I think one has to come up with a sustainable way of, social isolation. It's a bit like the Swedish model. The Swedish model was an attempt to trade off, the spread of the disease, trying to isolate the people who are most at risk while keeping the economy going, whereas here what's happened is a much more draconian across the board social isolation. And, that's just not sustainable in the long run. So there's a lot of interesting research being done by social scientists and other people at the moment, by epidemiologists, trying to understand what's the right trade-off here. I think it's clear that there are some groups that are much more vulnerable, elderly, people with different types of problems, respiratory problems, heart problems. So we have to find a way of protecting them while moving, the rest of the society back to work. So I think all the evidence is that, this is here to stay. So we can't close everything down for a month and then the problem goes away. So we need to find a mix in order to get the economy going, because what we know from the past is that you can get enormous hysteresis, and what businesses go bankrupt and people get laid off, you can't just restart that painlessly or costlessly. There's enormous shadow of that, and that creates social problems and poverty. And so yes, we have to find a recipe for balancing the health interventions with getting the economy going, but that needs cooperation, it needs discussion, it needs the government to take seriously advice from experts, not denigrate it, which the Trump government has been, become an expert at.
I mean, what you were referencing before, that balance between lives and livelihoods. And so as governments try to navigate this, that balance between saving lives, which is vital, paramount, but also making sure that livelihoods are safe. Your point about experts, it's interesting because, of course, whether it's in the US or in the UK, as populism was on the rise, more and more experts were seen as less important. And some people have made the reference to Germany doing well because they have a scientist in Angela Merkel.
Yeah.
So do you think scientists or experts will become more appealing in politics or not?
Well, yeah, there's different sorts of expertise. I mean, I think the problem with expertise is, most experts think the thing that they're an expert in is the only thing that matters. And that's a danger in a situation like this, because many things matter. Sometimes you have to make tough choices also. Experts differ, and there's so much uncertainty that you're going to get different opinions, and decision makers and politicians have to make hard choices. So I think you have to listen to expertise, and you have to take it seriously, and that's and then yes, I don't know that they're going to become more important but I think this is a moment where there really is kind of deep objective scientific knowledge about this problem. Who's going to come up with the vaccine? That's going to be scientists, and we desperately need their expertise.
So can I ask you regarding the vaccine, actually, because there's been a lot of talk about different governments working towards trying to find that vaccine, but there's also concern that it won't necessarily be shared. Everything from the UN to the Pope calling about the importance of the sharing of the vaccine and making it internationally available and available to those with low incomes. Do you think that is what will happen?
Well, I think that's an enormous challenge, and it's an enormous global challenge. For somebody like me who does a lot of research in Africa, sub-Saharan Africa, and in Latin America, You know, it's how do you get vaccine to people in the Democratic Republic of Congo, or, you know, Sierra Leone, or Colombia, or Bolivia, or there's just an enormous problem of global equity or inequity. You know, I mean, that's something you've already seen. You know, I mean, there's that, you know, that if you take something like malaria, for example, you know, because the incidence of malaria is in poor countries, there's very little incentive for pharmaceutical companies in, you know, in the Western world to put a lot of effort into creating innovations to get rid of malaria or vaccines or drugs, because they can't sell it. They can't sell it to wealthy people. You can't sell that to Congolese people or Nigerians because they don't have the wealth. So that there's kind of inequities which are similar to that, which we already see, which have huge consequences for people in developing countries. And I suspect we're going to see the same thing again. We're going, you know, that even if a vaccine appears, how is that going to be distributed to you know, it'll be easier to ban travel and restrict movement than it will be to spend the amount of resources necessary to provide that to poor people. So that's a huge concern for me personally. Yes.
Right, we're about to wrap up. We have one more question from participants, and I have my last question, then we'll be wrapping up. So the last question that we're taking from participants is regarding globalization. Do you think that the post-COVID-19 world will have a stronger level of globalization, less globalization, both politically and economically?
I think it's almost inevitable that we're going to see a period of much reduced economic globalization. I would think it's bound to be a contraction of international trade and connections, but you know, thought of, and you know, this is the example I gave earlier, thought of more broadly. You know, I'm not sure whether globalization will decrease. You know, we have all this fantastic technology, modern technology, which can link up people, you know, all over the world. Everyone in Africa, you know, all my friends in the Democratic Republic of Congo, you know, no matter how poor or living far from Kinshasa or in the bush, everyone has a mobile phone. You know, they have a mobile phone. They're connected to the world. They may even have a smartphone in the way that people have never been before. And now, you know, as a consequence of this crisis, you know, here we are, you know, you're in Dubai and I'm in Chicago. We're talking with people from all over the world. It's creating communities, you know, that could have created before, but we've been pushed out of our comfort zone. And I find that sort of exciting, and that's globalization, isn't it? You know, so trying to understand each other's problems and learn from each other's experience and enjoy cultural differences and intellectual differences. And you know, so I think that's a kind of different margin of globalization, but that's something that may flourish. And I personally find that very exciting.
Well, I mean, you've almost answered the question, which was, what's the silver lining in all of this? So you can't use both. You've already said that. So you have to find another silver lining. So we end our really thought-provoking conversation on a high, which is there a silver lining in all of this?
Well, I think that's one of them. You know, I think, you know, a bigger silver lining, you know, which is potentially out there, you know, is that, you know, this is a Great Depression like moment. You know, it's a moment where, you know, many things reconfigured themselves, you know, not just, you know, in the terms of government, you know, but in the intellectual life, you know, in cultural life. You know, think of the economics profession. The economics was radically changed in the 1930s by John Maynard Keynes, you know, in the middle of the Great Depression. So the Great Depression created an intellectual revolution, which enormously changed academia and economics, you know, in very positive ways. It gave us tools to sort of think about the world that we didn't have before. So that happened in Western Europe, it happened in Britain, it happened in you know, it happened all over the world. You know, the only problem, of course, thinking about the 1930s is that some societies collapsed. You know, Italy collapsed, Germany collapsed. You know, they were in the wrong side of my diagram, if you like. And so that's the thing that concerns me. But that doesn't mean, you know, history doesn't repeat itself in any kind of simple way. You know, we have lots of institutions that didn't exist in the 1930s that would mitigate against that happening again. So I do see, you know, the real big silver lining is, you know, is this a moment where we can rebuild our social contracts in much more inclusive way. And that's the really exciting silver lining, it seems to me. But I don't know how much grounds for optimism there is at the moment.
Well, thank you very much. Thank you for sharing your thoughts with us, for taking the time. We could have taken this conversation in so many different directions, but what's important is that there is a sense that we're all in this together one way or the other, and hopefully there is the enlightened leadership around the world to take us through this course. I want to hand back to Reem and to thank the World Government Summit for giving us this platform, and inshallah we can all reconvene in person in the future in the UAE, but until then, thank you for giving us this opportunity, Reem.
Thank you, Mina. Thank you, James, for such a lovely webinar. The Q&A keeps coming in from all around the globe, and it's been a pleasure hosting you both. And I think I'm going to end on a sweet note. James, in your new book, you said society and state, we have to work together. And I think that in a sense is the silver lining of all of us working together. And hopefully we'll come out of COVID even stronger. Thank you so much both for your time, and thank you for everyone who signed in.